Hello, my name is Temitope Shembanjo. In this video, I'm going to be demonstrating sterile gloves and Foley catheter insertion. To start with, I'm going to make sure that I'm working on a surface that is very clean, and for the purpose of this video, I'm going to be pretending that the bed is within my hips, because for sterility, I have to be working within my hips and my shoulder in order not to break sterility rules. Now, I'm about to start. I've been able to verify the PCP order with the patient care plan, and I have been able to affirm that informations are correctly and rightly stated. And again, moving forward, I've been able to gather my supplies and equipment that I'll be using, and I have here with me one pack of Foley catheterization tray, checking for integrity, looking for the date of birth, a date of expiration is going to expire on March 2022, and looking at it is intact, no cuts, no rip of any form, so it's good to use. And for my pack of sterile gloves, I have here with me a pack of sterile gloves, intact, no rip, no tear of any form, is good to be used. So I'm looking for the expiry date, August 2022, which means both are good to be used. I haven't done that. Before I started I already performed hand hygiene, and I put on, I washed my hand and I performed hand hygiene. Now, I want to make sure I'll be going to the patient, and I want to make sure the patient is in good shape. Hello, how are you? My name is Temitope. How are you? Can you please verify your first name and last name for me? Jackie Smith. Good. Can you verify your date of birth? 03/07/1972. Thank you, Miss Jackie. Like I told you, I'm Temitope. I'm a student nurse from Mountain View College. I am here today for the insertion of your Foley catheter. Is that okay by you? Fine. I've been able to provide privacy, and I'll make sure my patient is covered and only the perineal area is open, and I'll make sure I open her leg in order for me to have enough working area like I have done. Then, Miss Jackie, I have two questions for you. Are you allergic to latex or betadine? No? Okay, that's fine. She's good. We are good to go. Just to let you know, like I said, I'm going to be inserting your Foley catheter. Please feel free to let me know if you have any concern while we are doing that. Is that okay by you? Fine. We are not going to stay too long on it. Now, I've been able to verify my patient. It's now for me to get myself prepared. The first thing I'll be doing here is opening my tray. I'm not going to trash this because I will be using this as my trash in order not to break sterility rules. Though I have a trash bin right beside me here, but this will be serving as my trash, which I'll place at the feet of the bed right here. I don't need this, so I'm going to take it off. Now, I'll carefully open this. I cannot touch anything in this box because I am not sterile yet. So I'm going to pull this a little bit in order for me to have space to put on my glove. Now, I'm going to go ahead and open my gloves. I'm going to be fixing my dominant hand first using my non-dominant hand. My right hand is my dominant hand, so I'm going to pick this, to pick the tip, and I'll be having my glove this way. I'll make sure I pull this past my I'll pull this past my wrist. You can see it's not that perfectly fixed, but there's no problem. Since this hand is not sterile, I'm not going to touch it. I'm going to use the sterile hand to pick this. Once I'm now sterile, I can now fix it. So I'll pick this. This is sterile, so I can use this. I'll also pull it past my wrist. So this is well fixed. I can now use this non-dominant hand to fix my dominant hand since it's now sterile. My two hands are now sterile. So I'm going to, from inside, I'm just going to take this and I'll trash it. It's not going there. I cannot bring this closer from inside. So my hands are sterile. I now can touch what I have inside here. I don't need this one. I'm going to set it aside. I don't need it. I need this because this will go right under the patient. Here is a pad. The plastic side will go at the bottom, while the paper side will be at the top. I'm going to be fixing this without my hand touching any part. You can see I'm being careful enough. I don't want my hand to touch any part of the body of my patient. So I can still move this forward a bit. Yeah, I'm working within the sterile section. Now, I don't need this. I'll take it off. Here is my iodine, which I'll need. I do not need this. So I'm going to bring out this tray right here. I'm going to bring it here. And for the iodine, I'm going to open the iodine and pour it on my cotton balls. I've been able to pour it. So the remaining one that I don't need, I'm going to trash it. That way, I've been able to do that. And I have here with me my lubricant. I'm going to open the lubricant and pour a little right here. And the one I don't need, I trashed it. I'm going to put it aside. I don't need this one too. I'm going to put it aside. Now, I'll be going ahead to remove this. I do not need it. It's going to the trash. So I'm going to have this cord. And I'll put it in the box. But I'll quickly do something. I will lubricate the tip with I'll lubricate the tip with the lubricant like 2 to 3 inches. I'm going to insert. So I've been able to lubricate it and sit it in the box. But then I'm going to fix this. Here is my 10 ml sterile water, which I'm going to use to inflate the balloon. So I'm going to take off the cap and fix that to the catheter. So I'm going to get that ready too. So that is set. So now I'm going to be cleaning my patient. Before I can do that, let me explain that my dominant hand is my clean hand. Non-dominant hand, I'm going to be touching the labia. I'm going to be placing that on the labia to open the labia. And once I put that, it's going to be a dirty hand. And I will not release the labia until I successfully insert the catheter. So now, I'm going to start the cleaning. I'll move this one closer. I will use my left hand this way to open the labia. So, and I will use my forceps to pick the cotton balls that already put iodine on. So I'm going to start by doing the cleaning from the right to the bottom, outer, and this goes into the trash. The second one, my forceps from top to the bottom, outer, coming out, and on the labia, top, outer, labia, one, down, outer, and top to the bottom, outer. So I've been able to use the cotton balls to clean the labia. So I'll still have my hand on the labia. I will not release it until I successfully insert the catheter. So I have the coiled part. So I'm going to be inserting the catheter. I will insert like 2 to 3 inches into the I've been successfully insert the labia and the catheter into the labia. So now, since I'm now successful in insertion, I can now release the labia. Then I can now inflate. And I want to inflate the contents, 10 ml syringe, and I want to inflate the balloon. I have been successful in inflating the balloon. So there is my syringe. So now I'm going to secure the catheter, the tubing. I'm going to secure it with non-allergic tape to the leg. This way, I'm going to secure it here, right here. Since I've been able to insert the catheter, my sterilization process is over. Then I'm going to hang the bag. I'm going to hang the bag, the tubing bag, into the non-moving part of the bed. So I've been able to do that. Now I'm going to, after that, I'm just going to touch the catheter and see it's okay. So everything is all right, fine. I've been able to do everything. So now that I've done that, I can now place my patient in a comfortable position and take off my sterile gloves. So I can now take off my sterile glove and I'm going to perform hand hygiene. So I'm going to clean the working area. So I'll make my patient comfortable and I'll be able to clean the working area. Now, for the removal of the catheter, since I've been able to do that, the next thing I'll be doing for the removal, I'm going to verify my patient again and with what the provider has ordered, and I'm going to identify the patient with the 2 forms of ID, name, Jackie Smith, and a date of birth. So after I've been able to do that, I'm going to provide privacy, and I'm going to perform hand hygiene again, so that I'll be able to perform hand hygiene, and I'm going to be putting on clean glove. So I'm going to place under my patient. I've been able to put on a clean glove. Under my patient, I'm going to place a clean pad under my patient, waterproof pad under my patient again. So since I've been able to identify her and I'll tell her what I want to do, I'll put a clean pad under her. Then I want to empty the urine. I'm going to empty the urine in the tube into the catheter, and I'll be making use of my 10 ml syringe that I inflate with. I'm going to deflate the whole 10 ml content back. So I'm going to ask my patient to take a deep breath, and I will gently and smoothly remove the catheter. But the first thing I will do is I'm going to deflate the catheter by using the 10 ml syringe. So you can see the water is coming by itself without any stress. It's coming by itself. Good. Correct. There you go. So I've been able to withdraw the 10 ml to deflate the catheter. So, and I'm going to ask my patient to take the deep breath like I said earlier, and I will gently take off the catheter like I've taken off the tape. So I'm going to take off the catheter gently. I'll look at the tip right in my hand, and I'm going to, so that this way, and I'll do in the glove. So, and I'll go take it off. I'll take off my glove. I'm going to perform hand hygiene again, and I'm going to cover my patient, and I'll clean the perineal area. I'll clean the perineal area. So perform hand hygiene, put on a new glove, clean perineal area, take off this. I'm going to adjust her bed, and I'm going to give her a call light in case she needs me. Please feel free to call me. Okay, Miss Jackie, please feel free to call me. I'll be going to the huddle room. I've been able to lower her bed and provide safety. Thank you.